doctor, consumer's doctor on the behalf of foremost organization. In the prior episode, I talked about impaired health support plans. Today we'll talk about eligibility of the impaired health support plans. Who are eligible? Who are eligible? Providing eligibility to both uninsurable individuals and small group members will provide targeted support, choice of plan options, and affordable health insurance for the sickest among us who are eligible. So let's look into that. For the sickest among us, prior to Obamacare, many consumers avoided applying for insurance because they feared failing strict insurer underwritings. That was the reason. They worried about privacy. They were concerned that any poor health characteristics would become a part of their electronic record that could affect other personal business needs. That is the reason. They worried about exposure of marijuana and another drug use if they were using. So they were worried about their privacy. Under the personalized health insurance, people with medical issues can apply can apply for insurance without fear of reprisal or a stigma. This is very important, folks. They can apply without any fear of reprisal or stigma. So, who is eligible, you might ask, for, for an appeal, to the Health Review Authority under the public-private partnership? A likely candidate for impaired health support plans. Who can appeal for that? The answer is any individual, who has applied to a licensed participating insurer or insurance company. Any individual can apply. So who would qualify? Number one, Health Review Authority would look into a person whose application has been rejected for the coverage. They will qualify. If it has been rejected by the insurers, number one. Number two, unable to agree with the insurer or insurance companies on alternatives that allow for a premium of less than 25% over standard premium rates. He is eligible. And number three, has an insurer proposing contract benefit limits of 25% or more of the policy value. They will be eligible. And number four, has a combination of any one of those above things. Let me repeat this again, folks. Who's eligible for the impaired health support plans? Number one, who has been rejected for coverage by the insurer. And number two, is unable to agree with the insurer on alternatives that allow for a premium of less than 25% over a standard premium pay rates. And number three, has an insurer proposing contract benefit limits of 25% or more of the policy value will be eligible. And number four, any combination of the above, they will be eligible for the impaired health support plans. Anyone who is a part of a group of 50 or fewer employees and has a medical condition or a history that causes the group plan to be priced at at least 10% or higher than the otherwise standard group rates. Insurers, the standard premium rate should not be more than 10%. If it's higher, they're eligible for the impaired health support plans. Again, any applicant determined by the Health Review Authority to be truly uninsurable will automatically qualify for the impaired health support plans, folks. Yes, automatically. Applicants can then select among the multiple plans offered by the impaired health support group. Then you may be thinking that sounds reasonable. Are there any additional requirements? Yes. Any individual must be a legal citizen of the state for at least 12 months prior to the application to an insurer. They have to be legal citizens, folks. Let's go into it. Let's get more specific, folks. Let's get more specific for the policy wonks, out there. There are, I will give you the following reasons they're not eligible for the impaired health supports. Who are not eligible? Well, we'll go into that because I'm sure a lot of people want to know who are not eligible. Number one, anyone eligible for health insurance benefits under Medicaid are not eligible. And number two, anyone eligible for another state or federal plan of coverage or program, including but not limited to Medicare, TRICARE, or Veterans Health Care. They are not eligible. And number three, inmates of public institutions, anyone eligible for existing public programs are not eligible. And number four, anyone eligible for a self-insured employer coverage, they're not eligible yet. Yes. And number five, anyone who voluntarily terminated coverage in an impaired health support plan within previous 12 months, they're not eligible, folks. They're not eligible. And number six, anyone on whose behalf of impaired health support plan previously paid over $1 million or more in benefits are not eligible. Yes, they're not eligible. Any person who no longer meets impaired health support plan eligibility requires may be terminated at the end of the earlier policy period or at an enrollment in other coverage. Impaired health support group plans cannot be rescinded unless application is approved due to fraud or material misrepresentation. They cannot be if it's a fraud, they cannot be rescinded unless there is a fraud and a material misrepresentation. So these are the things these are the folks are not eligible for impaired health support plans. So I gave you who are eligible. I gave you who are not eligible, folks. I hope this clarifies. These impaired health support plans will focus on who need the most care, who who really deserves to get a decent premium, and who should get all the benefits of impaired health support plan. In a smaller group, folks, if one family member is impaired, it doesn't need to affect the entire family. If in a smaller group of under 50 employees, if the family is insured, if one member is impaired, he can be given impaired health support plan, but the rest of the family premium should not be any higher. He should be eligible for an affordable premium. So by removing one applicant out of that family and putting them in impaired, so the group family coverage and smaller employer groups can provide the health insurance for the rest of the family. By removing one person, their rates will remain low. That way, the premiums should not go up just because there's one person who's impaired. So, by putting them in the impaired health support plan, they will be more focused. And that's what we need to pay attention to. And even for those folks, we need to have incentives and rewards under the personalized healthcare. Folks, thanks for listening. We'll continue to talk about personalized healthcare, so-called HIP. This is Consumers Doctor on the behalf of Foremost Organization. We will see you in the next episode. Goodbye. Salute.